So we've done all the right things. We've done everything's been perfect throughout this whole process. We've talked about options with patients. They are very clear about which ones they want. And then they say, I'd like a predetermination of what my insurance will cover on this. Now let's say it's a $3,000 treatment plan. And let's say that it's pretty much restorative, not much surgical, but it's pretty much restorative. So for the most part, in general, how much do we think the insurance is going to pay if they pay for those services? How much? About $1,000? Why is that?
That's their maximum.
Right? But how do they get to that 1,000? No. All right, they're going to pay what percentage? All right, 50 or 80%, right? Right? So with your eyeballs, you can look at that treatment plan and your brain can pretty quickly calculate that, you know, Mrs. Jones, we probably don't even have to do that. You have $1,000 benefit a year. You've not used any of it that we know of this year. If the insurance company holds true to their commitment to you, that's how much you probably will get to work with. The rest will be on your own. How important is it for you to know precisely the number of dollars and the number of cents you could expect? See, I want to know what this is about, because I can tell you there are many times when a patient says, well, send in a predetermination. And I can tell you what that's about for a lot of them. I don't really want to do this. Let's just delay this. You know what? I'm not going there. I don't want to waste my staff's energy, time, all of that for that person who doesn't even want it. I don't want to do that. And that's where you have to make a business decision about when and where you're going to accept the responsibility for doing that paperwork for someone. Patient says, well, I really want to know how much my insurance is going to cover. I might say to the patient, you know, Mrs. Jones, if it covers all of it, what kind of a decision would you make? Versus if it covers none of it. It would be helpful for us to know the part the insurance is going to be playing in the way you make choices. Because I think we can help you better if we understand that. Listen, I'm very, very clear that we're losing our middle class. People are more dependent on every dime they can get that they feel they're entitled to. I get it. And I think responsible patients, and this is the double-edged sword, responsible patients want to know how much their auntie is going to pay and how much they're going to have to come up with on their own, and how that money on their own is going to be paid to you. I think that's a responsible patient thing. And where a patient says, maybe it's a retiree, and the patient says, look, we still have some benefits from GM, we're retired, our pension has been cut, and I want to make certain that before we commit to something, I'm positive that I can pay you the amount that I would have to pay you. I got no problem filling out a predetermination for that patient, because I'm now understanding what's behind it for them. But someone, I don't know if Mary Beth, you were with me, I was in a practice one time, and they were struggling with this predeterminations. And they said, how many predeterminations are we supposed to send in for a patient? And I said, what? She said, well, every year we talk with this patient about this treatment plan. And they say, okay, find out how much it'll pay. I said, how many do you send in? Well, one, we've not done 9. I said, are you crazy? What part of I don't want the dentistry do you not hear? Seriously.